Maternal mental health refers to the state of emotional and psychological well-being of the woman during pregnancy, delivery, and the period up to 1 year after delivery. Identified as a critical mediator between social adversity and poor infant growth, research shows reported absent routine antenatal and postnatal screening for maternal mental health disorders in Ghana. Coupled with the lack of awareness and stigma due to low formal healthcare seeking behavior among affected women, inadequate access to maternal mental health services, among others, Ghana's cases are above the globally reported 10% of suicidal ideation figures. To change this narrative, Ghana Health Service has been training nurse managers, public health nurses and midwives to adequately position them to tackle the menace. A psychiatrist with the Ghana Health Service, Dr. Francis Opong, tells Joy News, some women who present with maternal mental health conditions end up at prayer camps as society lives in a state of denial.
We only get severe cases where mothers are throwing their children away, not breastfeeding and taking proper care of them. Even that, it's about 1 to 2 out of 10 that will find their way to a healthcare facility for attention. On the basis of that, most people will believe that it is spiritual, and so they should end up in some spiritual health centers, which eventually worsens the situation.
The Ghana Health Service, through the implementation of its maternal mental health policy, is encouraging the general public to pay attention to mental health of pregnant women and new mothers, while advancing the knowledge of health workers to attend to such conditions. Ashanti Regional Director of Health Services, Dr. Emmanuel Kojo-Tenkran, underscores the importance of the policy.
Pregnancy itself is a very stressful condition because it's associated with a number of risks. So every pregnant woman is under stress, and sometimes it can become protracted, and if you are not careful, you may lose the woman, or the woman may progress into what we call full-blown psychiatric condition. So under the policy, we are to create awareness for people to know that during pregnancy, you may have some of this condition, and then prepare people's mind, the caregivers, and then the family, that they have to take a very good look at the pregnant woman and then the woman who has just delivered.
Meanwhile, the Ashanti Regional Mental Health Coordinator, Faustina Nyako, is calling for support from partners to reduce the burden of depression among pregnant women.
When someone is pregnant, they go through a lot of changes in the body, and it stresses them. So encourage them. Husbands should take good care of their wives, because 2 people who get pregnant, not 1. But we do a lot of things. When your wife is pregnant, it's now that you're going to look for another woman to satisfy you. Stay with the woman, encourage, and give chop money to. And don't keep it for your girlfriends.
The Ghana Health Service has lined up a series of training workshops for its staff. From Kumasi, for Joy News, Ohiminteria reporting.